there, I am Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Mary Phillips, 10/2/19.
All right. So, can you tell me where you are today?
Hospital.
All right. And what is today's date?
March 27th, 1946.
All right. So what I'm going to go ahead and do is just look around in your room, double check and make sure everything is out of your way, since you did come in with some confusion, okay? So her tubing to her IV is not kinked, it's straight. There is no destruction to the bathroom. There is a clean view. She has water at her bedside table, and she has her call light in reach. So the first thing I'm going to do is do a little assessment on you, okay, since you came in. Going to go ahead, you had your vitals taken just a little bit ago, and your heart rate was, or your blood pressure was 92/58. Your heart rate was 122, so it was a little elevated, and your respirations were 24, and your temperature was 103.6, so you're running kind of a fever. That would kind of go with what you had when you came in. So the first thing I'm going to do is I'm just going to listen to your heart sounds, your lung sounds, and make sure everything's clear, okay? All right, go ahead and lean forward. I'm going to go ahead and do the back for you. All right, go ahead and sit back. So I'm going to go ahead and have you turn your head to the left. All right, and go the other way. No JVD there. Do you having any pain in your upper extremities? No? Okay. You have no edema in your arms. Your IV site is looking good. No redness, no anything like that. Are you having any pain?
No.
No? Any pain in your IV site?
No.
No? All right. I'm going to go ahead and take your pulses on your arms. Double check that your pulses are there. And you have radial pulses bilaterally. I'm going to go ahead, and you have no tenderness in your stomach. All right, I'm going to go ahead and listen to it. And you don't have any distension or anything like that in your abdomen. It's all flat and round. Alright, bowel sounds times 4. Go ahead and let me know if any tenderness while I'm palpating. Any tenderness there? No? Alright. I'm going to go ahead and take a look at your legs. Are you having any pain in your lower extremities at all?
No.
No? Alright, and I'm going to double check you have some nail polish on, so I'm going to feel your fingertips. And you have a cap refill on your fingertips for less than 3 seconds, and they're warm. Your skin is warm, pink, and dry as well. You don't have any edema in your ankles. No open wounds. And your cap refill on your toes are going to be less than 3 seconds as well. Can you pull on my feet with your feet and push up with your feet? Alright, and can you do that same with your hands? Okay. Alrighty. I'm going to go ahead and feel for pulses in your legs. You got bilateral pedal pulses. You have no edema. You didn't have any pain in your stomach either. Your skin is all intact. Your skin turgor as well is elastic. You have no drains or anything like that for me to assess today. When was the last time you had a bowel movement?
Yesterday.
Yesterday. And did you have any passing of gas?
No.
No? Alright. And are you having any trouble urinating?
Yes.
Yes. Is it burning?
Yes.
Yes? Alrighty. So, are you going very frequently, or are you just kind of going as you feel? Frequently? Alrighty. So look into that. Some of your information has kind of showed that you had a UTI going on. So when you came in today to the emergency department, they were suspecting you had a stroke. But when we did some further testing, that kind of was ruled out because your CT scan was negative for any bleeding. And the neurologist is believing that you are not having any strokes. So the next thing that we just went and looked at was some different tests to see, because of your confusion and your pain when you're urinating and some foul smelling urine. We did some tests such as a urinalysis to detect that you did have a UTI, which is a urinary tract infection. And this is happening because your urinary tract is getting infected with some bacteria, and your urinary tract infections are caused because your tract is not staying sterile like it usually should be. So what we're going to do is order urinalysis to get what kind of bacteria is in there. You're experiencing some altered mental status because it's very common for UTIs in the elderly. And you also are going to see that burning when you're urinating because that's frequent with those type of things when you have a UTI. You also could possibly get some kidney stones with a UTI. And with your bowel movements, you said you had one yesterday. Have you had one today? No? Okay, so with the bowel movements, it could cause some bowel incontinence, which you might see when you start getting more of these symptoms and seeing that you're not going as frequently. And because we're going to probably start you on an antibiotic, it's going to suppress your immune system. Do you have any questions?
Yes. How to help other UTI?
So ways to help it from coming back is going to be increasing your water intake. You could even take some cranberry juice and things like that to help with your UTIs. But when you're drinking water, it's going to dilute your urine. So with diluting your urine, it's going to help with that urinating pain and things like that. When you also are going to the restroom, making sure that you're wiping front to back and not back to front, because you're going to just bring in more bacteria in. And when you are going to the restroom, make sure that you're going frequently and getting all of that out. And if you do need help, that you're calling frequently for somebody to come take you to the bathroom and not wetting yourself, because that can cause some more inflammation and more bacteria to go in. Do you have any other questions?
No.
Alrighty, so we will go ahead and insert 2 large PVIs to get some blood out of you, and we're going to do a complete blood count. We do not have any type of solution running through your IV right now, but we will be giving you 3 days of IV treatment, antibiotics. Do you have any other questions?
No.
All right, and we will go ahead and discharge you home with some antibiotics that you're going to take by mouth tomorrow.